In this video, I'm going to show you how to do self-massage for cording, also known as axillary web syndrome. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. If you've had lymph nodes removed during breast cancer surgery, you may have developed tight cords running down your arm or down into your chest. I experienced cording after my double mastectomy and used my rehab background to figure out what actually works to relieve it. Self-massage is one of those things. It's simple but an effective way to release cording tension and also improve the range of motion of your shoulder. My cording was most pronounced in my upper arm area. Even though it wasn't as visible in my lower arm, there was tension there, and I had a noticeable change in my range of motion and my wrist because of it. There are three areas we're going to focus on: the arm, the forearm, and the underarm into the side of the breast. Don't skip that last one. It's often overlooked, but it's really important. I found sitting to be the most comfortable position to do the self-massage. Position your arm up and out to the side. You can rest your arm on something like a pillow or a table. This position is where you'll feel the tightest pull on the cord, and it'll also make the cord most visible. For the arm and forearm, start by using your fingers to make gentle circular motions along the length of the cord. This helps to release tension in the surrounding fascia and tissues. I would start in my underarm area and then I would work my way down my arm. You may find it more comfortable for your arm to be in a different position when releasing the forearm. Whatever works best for you. Regardless of where your cording is most prominent, I would still do the entire length of the cord from the underarm area where your lymph nodes were removed all the way down to the wrist. Next, switch to firm cross-friction massage. Use your fingers or thumb to go back and forth perpendicular to the cord like you're scrubbing across it. Work small sections at a time, going back and forth a number of strokes, and then moving to the next section. If you notice more tension in some areas than others, you can spend a bit more time releasing these areas. I usually did this in the same order as a circular pattern, so moving the length of the cord from my underarm area to my elbow first, and then down to my wrist. Again, regardless of where the cording is, there's still value in addressing the tension along the entire length of the cord, even if the cords aren't visible in all the areas. The next section is massaging the underarm into the breast area. This is a key area to release. If you trace the cord up, it often extends past the area where your lymph nodes were removed and into the breast area. My cording linked up to where my mastectomy scar started, and then it actually continued and went down my torso. Because everything in the body is connected, releasing this upper section can help reduce tension in the cord going down the arm and down the torso if you experience this like I did. Start off by massaging the area where your lymph nodes were removed. If you had a lumpectomy or sometimes with a mastectomy, this will be where you have a separate incision in your underarm. Alternatively, with a mastectomy, lymph nodes can be removed through the mastectomy scar, so even though you don't have an actual visible scar in the underarm area, there would still be scar tissue in that area to address. Sometimes you can even feel it. Check to see in your case, but I felt a bump for many, many months after surgery in this location. When massaging this area, you can use a circular pattern just like you did with your arm. Next, continue the massage from your underarm to the side of your breast. This applies whether you've had a lumpectomy, a mastectomy with reconstruction, or a mastectomy with flat closure. The circular pattern tends to work well for this area too. I found this to be quite a stubborn area to release. When can you start? Before you give this a try, just a reminder that it's best to start this at about 6 weeks post-surgery or once you've been cleared by your medical team. If you do start earlier, be gentle and be sure to avoid healing incision sites. As always, check with your surgeon or medical team if you're unsure. How much pressure should you use? You do want the pressure to be firm, so deep enough that you feel it, but not so deep that it's super painful. How long should you do the self-massage for? Just a few minutes a day can be effective. Focus on being consistent rather than doing really long sessions every once in a while. Because cording can be such a stubborn side effect, it's best to pair self-massage with some other strategies. I reviewed a number of these strategies in another video. If you prefer to have something to reference as you go, I created a cording guide. It includes step-by-step instructions with photos for each of the strategies. Print the PDF or follow along on your device. I'll link it below if you want to check it out. Remember, healing takes time, but small steps like these can help you feel more in control of your recovery. See you next time.